Our last section on health and stress is going to be a little bit about health psychology, and this is kind of a mixed bag where we're going to talk a little bit about illness and I guess our risk of illness, our susceptibility to illness, a little bit about treatment, and also a little bit about healthful behaviors and promoting healthful behaviors. But again, this is a little bit of everything to wrap up the chapter. And as always, just an overview and not a complete description of any of these topics, just making us aware that they exist. So, first off, we can talk about health psychology and what it is. So, this is an area of psychology that's concerned with how psychological factors can influence both causes and treatments of physical illness. Basically, are there things that make us susceptible to illness, ways of thinking perhaps, but also things like when we're being treated for illness, are there psychological factors that can make treatment more effective or less effective? So, a big focus here is trying to maintain and improve health and understanding how psychology and components of psychology can contribute to that. So, we're going to recognize this idea that behavior plays a role in maintaining our health. And because psychology is the study of sort of behavior and the brain, or our mental components and physical components, we want to acknowledge that there can be sort of internal and external behavioral aspects of all sorts of things, including how we maintain our health or don't, depending on the situation. So there are tons and tons of studies, and of course we can't mention all of them. Even the textbook only has a small selection of those. There's lots and lots of studies that can help us look at both psychological and behavioral factors when we're trying to prevent or treat an illness, how we might maintain more healthful behaviors, things that can make us more successful in those endeavors, and so on and so forth. So again, as you can see, this is a really broad field that encompasses a whole bunch of stuff that's related to being healthy, dealing with illness, recovering from illness, preventing illness, and so on. Now, we did do a section already where we talked about the different pathways that lead to illness. And specifically, we were looking at things like higher stress on our system leads to premature aging through wear and tear on our cells by degrading our telomeres. But there is one more concept that I wanted to introduce that I'm not sure comes up to the same extent I would like it to in our textbook. And this is the concept of the diathesis stress model. Now, this is a model that basically describes the fact that we have biological predispositions for different things. So we can talk about disorders, we can talk about specific illnesses, but basically, we will develop a disorder or an illness or not, depending on a whole bunch of interconnected factors. And so this diathesis stress model is all about how stress can influence and interact with a diathesis or a biological predisposition towards that illness. So my definition on the slide here is that this diathesis stress model is a theory that mental and physical disorders develop from a genetic or biological predisposition for that illness, which we would call a diathesis, combined with stressful situations or stressful conditions that play a role in precipitating or facilitating that illness. So this is, again, a very wordy way of saying that humans are going to have an underlying biological or genetic predisposition. So when people talk about being, say, high risk for something, maybe you have a family history of heart disease or circulatory issues or something. And in those cases, by saying we have a family history, we're saying that we have a predisposition, a diathesis towards those things. So we understand that there is heightened risk because of some inherited biological component. And then, of course, the more stress we're under, the higher the strain on our bodies, the more likely we are to observe that predisposition manifesting. Basically, we end up with higher risk from both biology as well as our environment. And so I'm sure you can see that if we have, say, low risk from biology, but we're in a really high stress environment, we might still develop that illness or that disorder because we've had enough of a risk from the environment that it might be sufficient to manifest the disorder. So it's always about a combination and sometimes an interaction between the two. So this is something that can be used to talk about all sorts of different disorders, diseases, illnesses, whatever. But we're just going to talk general disorder in terms of sort of biological predisposition and stress and the interaction. Now, I've seen a whole bunch of visuals for how to lay this out. This one is not my favorite, but if it works for you, we'll start here. But here we're looking at low to high predisposition for the disorder. So low means low diathesis, low likelihood, low risk of developing the disorder just from biology. Over here is high. Here we have our amount of stress. So low stress environment, high stress environment. This can be sort of cumulative number of stressful situations you've encountered across life or whatever. This is all no units, no nothing, just looking at the situation. And so this line here, this diagonal is the important part because we're going to see basically how much stress do we need to encounter before a disorder manifests. So from this line, we'd say, all right, if we have very low predisposition, even in situations with high stress, we're still in the blue. We're still not developing this disorder. But if we're high in our predisposition, we have a high diathesis, even with a small amount of stress, we are going to enter into the disorder developing. So that high risk from biology plus some environmental risk factors puts us to the point where the disorder manifests. If you have both high risk and high stress, you very much have that disorder developing. Now, this is just a visual to try and understand how you have sort of more or less predisposition and more or less environmental stress. It's not saying that as soon as you cross this threshold, everyone will automatically develop the disorder, and if you don't, you don't. It's just sort of illustrating the general idea. Now, that diagram does not work super well for me. So I like this visual, which is basically looking at, in this case, the disorder is alcoholism. And we have sort of two different colors here. So you can think of reaching this red line as hitting the threshold, kind of like this line here, to manifest the disorder. So individual 1 has a high level of predisposition. They have a strong genetic diathesis. They have a family history of alcoholism. Then here we have environmental stressors. Maybe they've had lots of exposure to drinking. Maybe if it runs in the family, it's something that was commonly encountered. Maybe something encouraged. So high stress and high diathesis means we've hit that threshold. They're likely to develop the disorder. But over here, the person who has the same level of stress, the same exposure in the environment, but has much less of a diathesis, much less of that biological risk, does not hit the threshold and does not develop the disorder. Now, one thing to keep in mind here, because again, all of these are talking about the same concept, we're just saying that having risk from genetics and risk from your environment, adding them together just means that you will have net more risk. The more risk you've accumulated from multiple sources, the more likely you are to develop the disorder. So even though these are sort of shown as if you hit this threshold, you will get this disorder, it's not deterministic. We're only talking about increased risk factors, higher likelihood of development, but it's never going to be all or none. We can have all sorts of things that can play into this. We can have things like resilience and protective factors. We've talked hardiness. We've talked social support. All of those things can help mediate some of those environmental risks. So even if we have a high risk from genetics, we are not guaranteed to develop this disorder. Even with lots of stressors, we might have healthy ways of coping that reduce the effect of those stressors. So increased risk is not deterministic. It is not all or none. We're just talking about increased risk, and that's it. We're also, when we're looking at these data points, we're talking about these risk factors, we're talking about predispositions, these are all based on correlational studies. So we can't show causal relationships, we can only show increased and decreased associations. So high correlations means that these two things tend to co-occur. Maybe we're developing high risk. But there's lots of other confounding variables, which I always try and stress when we're talking about things. So, other things in the environment, protective factors, all of those play a role. So none of this is meant to be absolute, all or nothing. With the diathesis stress stuff out of the way, we can now kind of get into a whole bunch of rapid fire stuff, starting off with stress and illness. A lot of this, again, stuff that we've mentioned, but just wanting to have explicitly on the slides. But if we talk about our sickness response, this is what we can call a coordinated adaptive set of reactions to illness that's organized by the brain. So when we talked about our fight or flight response, getting ourselves ready to face a threat, a sickness response is basically a more specific version where we're trying to respond not just to sort of a psychological stressor or a physiological stressor or something external in the environment, but this is our bodies getting ready to fight off an internal threat. So our bodies are going to try and maybe reserve resources, conserve resources, develop a defense, be able to attack invaders, and things like that. So this includes not just physiological changes, but also things like changes in external behavior. So people might actually withdraw from activity. You might also eat more in order to have resources available to fight off an illness. So whenever people are getting ready to be, or when they are getting sick, goodness, you might find that you're low energy. You're going to move less. You're going to want to, say, curl up on the couch. You're going to want to eat a bunch of comfort food, and you're going to want to do very little. That can be part of your sickness response. That can be part of your body needing that energy to be doing other things. So we've before mentioned our immune response. So getting our immune system ready to identify and then fight off and get rid of any invading cells. So whether this is bacteria, viruses, whatever. So this response is going to begin with activating our white cells, sending those white blood cells specifically out into our body through the circulatory system, moving through our blood. We also have talked before about our cytokines, where they were getting us ready to sort of heal injuries and things like that and fight off stuff that could come in with those injuries. But this whole illness response is specific, not so much to those external physical threats, but to that internal threat. And of course, all of this is going to have some similar effects where we're going to have increased levels of stress relating to increased levels of sickness because they're using a lot of the same systems. So when we had mentioned that general adaptive syndrome, I think, whatever our 3-phase response to stress was, and we use up lots of resources, and then our immune system is compromised and we're more susceptible to illness. It's because a lot of these responses are also active when we're trying to fight off illness. So not being able to produce a proper sickness response internally means that we are less able to fight off illness. So high levels of stress makes us more susceptible to illness, and it ties to a whole bunch of really unique things. So if we're looking at chronic conditions, so when you have high levels of stress, you are more likely to develop chronic illnesses. So a lot of these, again, we can say are going to tie back to our cardiovascular system. So things like bronchitis, say strain on your heart. So things with your heart firing properly, those can be related, but also sort of system-wide things. So arthritis can be found in multiple joints and also correlates with high levels of stress. You are more likely to develop arthritis. And again, we're stressing that diathesis thing. We can have predispositions, we have increased risks, but it's never that guaranteed thing. So stress can be something that's maybe a precursor to health problems. But again, because we're looking at a lot of correlational data, we just know that high levels of stress correlates to high risk of a bunch of conditions. And the more stressors we have, the higher the risk. Now, this is what I wanted to get into for sort of specific things that we'll see. Well, as we encounter very stressful situations, we can find that our immune functioning is going to drop off fairly quickly. Again, when we looked at our fight or flight response, one of the early things that we'll observe is an increase in immune functioning, preparing for injury, preparing for infection that can come from that early injury. But within about 24 hours, we're running through lots of resources and our immune functioning is going to decline. So there's a temporary boost that turns into a long-term detriment with prolonged stress meaning more and more of a decrease in our immune functioning. As this is worsening, or I guess decreasing in functionality, we can find that pre-existing conditions, so maybe you already have, say, arthritis or bronchitis, those pre-existing conditions can be more severe. So you might find that it's easier to set off, say, an asthma attack if you're someone with asthma. High levels of stress would mean that once you trigger an attack, it might be worse, or it might be easier to trigger an attack. For other things, say MS and other autoimmune diseases, high levels of stress can actually lead to things like flare ups, increased in symptoms. We can see things like issues with arteries. So, circulation can be affected because a lot of our stress hormones and stuff downstream from the release of those hormones can build up in the bloodstream. And if we look at very long term and oftentimes very severe levels of stress, we can find that it correlates with reduction in the volume of our hippocampus. And we should know by now that the hippocampus is related to memory. So, reduced volume to the hippocampus usually ties to reduced functioning of the hippocampus and difficulties with forming new memories, retrieving old memories. We'll also find some interesting things. So, in high stress situations, so especially if you look at, say, literature on trauma and having very specific events that cause high levels of stress in acute scenarios, very quick traumatic events, sometimes you'll find a reduced formation of memory in those moments, specifically because of all the hormones floating around, all of the different stress signals where our bodies don't prioritize forming long-term memories when we're really focused on survival in the moment. So sometimes we'll find that people who have lived through traumatic events have very little or no memory of the event itself, and that can actually be part of the effect of high levels of stress in the moment. But this deterioration is more about long-term exposure to stress and having it lead to decrease in the volume of parts of the brain over time. All right, moving on, because there's so much we could talk about there, but we won't. The textbook goes on to talk about recognizing and treating illness. And we're just going to acknowledge this and move on quickly. But basically, people have different thresholds in terms of paying attention to and responding to or seeking treatment for their physical symptoms. You probably recognize this maybe within your own family or friend group. You might have an individual who basically needs to be at death's door before they even consider going to a doctor. Or you might have a friend who, at the drop of a hat, thinks that their sniffle, it's not allergies, it's something really, really bad. It might be a really terrible flu or cold or something. So different individuals are going to react very differently to what might end up being similar symptoms. So some people might be more likely to seek treatment, maybe even if they shouldn't. Others might not seek treatment even if they should. So lots of individual differences, and this can be based on experience. So if you've had something that has similar symptoms before, maybe you typically get, say, bronchitis or a really bad flu every year, you might be less likely to seek treatment because you know how to handle it. You know to sort of eat a certain way and stay home and rest and all of those things, especially for stuff that doesn't necessarily need medication. But the experience can affect it, individual thresholds for, say, things like pain, because different individuals will have higher or lower tolerance. We can also have other things like insurance, having access to medical care. If you don't have a convenient, say, pharmacy near you, or you don't have easy access to a clinic, or you have to pay to get to either, you might be less likely to use those resources. So, all sorts of factors to consider here. We do know that delaying treatment in serious situations can be dangerous. So, you might be really, really sick and should be seeing a doctor, but you've put it off. You might get to the point where the illness is so much worse than it could have been if you had sought treatment earlier. So, it got worse, it now needs even more intensive interventions. So perhaps instead of something that could be treated by a tablet, a medication you can take easily, you might have to be hospitalized and given, say, intravenous treatment or even end up in surgery depending on the situation. But there's also the other side of things. Maybe individuals who are quick to go to the doctor with symptoms that are mild, they're seeking treatment in situations that might not need it. So that could put strains on resources. Healthcare is a huge thing to talk about, whatever country you're in. But with Canada and having free-ish healthcare, um, you can get very long wait times. You can get lack of availability at, say, family doctors or general practitioners. So it can be really hard for the people that need treatment to seek it because the system is not capable of handling volume. And this could be made worse by people who don't need to be there. There's also a specific term their textbook mentions, which is malengineering, which is when people can feign medical or psychological symptoms in order to get something out of the system. So this could be, say, drug-seeking behavior. This could be individuals looking for attention. Again, sort of not needing treatment, but going to seek it. And then, of course, one of the things, since we're talking about our health psychology and we're talking about how can we understand people's behaviors in relation to health, education on when you should or should not seek treatment is actually something really important. So education and programs for awareness in society can really help. So things like cancer awareness, and especially like testicular cancer is a really big one where they've had a massive surge in media publications to try and get people aware of things that are early warning signs for cancer, because there's a very high rate of individuals who should be seeking treatment but don't think it's severe. So those educational programs, those billboards, those commercials on TV are meant to get individuals to be aware of things that are warning signs, things that they should seek treatment with their doctors to try and get early treatment so we don't have things escalate and get worse than they need to. And then this slide was actually just a really interesting study. They were specifically looking at whether some of those individual differences in, say, complaining about symptoms, especially in this case, pain, are people who complain more about pain maybe oversensitive? Are they over-reporting? And this was just looking at fMRI scans. So these are read as high levels of activation. And our pain centers are going to be right around, actually, let's find right about here. Yeah, so they're labeling it for us, I guess. So yeah, here. So that primary somatosensory cortex, and then in here, this anterior cingulate cortex. This is going to be part of those subcortical structures we've mentioned in other places, but these two are both involved in perception of pain. And so they were looking at individuals who had high pain sensitivity versus low pain sensitivity. And the whole idea was, are the people who are very sensitive to pain actually experiencing a lot of pain? Or is it just something like they're over reporting that pain? So they're complaining a lot because that's just what they do, or are they complaining a lot because it actually hurts a lot? And what they find, as you can see, is that the high sensitivity to pain people have more of a pain response to the same stimulus, and low sensitivity to pain people have less of a response. So those who report being in more pain are actually getting the activation that there is more pain. So we get to see individual differences in pain from similar stimuli, which can then tie to their vocalization of that pain. So a couple of really neat things here, seeing those individual differences in how we react to the same stimuli, but also in terms of pain in the brain being equivalent, or I guess related to the expressed pain of those individuals. So it's not just exaggerated, it's not just over complaining. There is something physiological going on underneath. And we've talked before about pain and our experiences with pain, where pain is easily influenced by a whole bunch of things, including internal state, prior experience, expectations, current mood, all sorts of things. So yeah, interesting topic, but we're going to move on. And then our last little bit here is talking about health promotion, which ties us back once again to health psychology, where the goal would be to encourage health enhancing behaviors and discourage health compromising behaviors. So, how do we get people to do things that are good for them? What kinds of things make them more likely to exercise, to practice, say, safe sexual practices? Going and getting regular checkups, exercising more often, eating healthier, all of those things. So we'd like to understand the psychology behind people's decisions in doing what they should and avoiding what they shouldn't. But we also have to acknowledge that people tend to engage in a lot of health compromising behaviors. So even though we know that smoking causes cancer, people still smoke. Um, we have people are very likely to eat high fat diets, who are going to go and eat a lot of fast food, who lead a very sedentary lifestyle and are unlikely to go and seek out sources of exercise. And all of this is kind of interesting because we have that awareness, that knowledge that we should be doing the good and healthful things and we should not be doing the health compromising things, but that's not what happens in practice. And there's a whole bunch of stuff behind the scenes on why we do or don't do one or the other. And it can tie into a whole bunch of different areas. But the interesting stuff can be things like with healthful behaviors, things that are healthier for us, they tend to involve short term inconvenience. So, yes, I would like to exercise more and be in better physical shape. But to get that long term goal with long term benefits, in the short term, I have to exercise and eat things that don't taste as good, and all of these things that are immediate. And when people are making decisions as to how they want to act, immediate consequences tend to be given a lot more weight than long term, far off in the future consequences. So we'd rather focus on the here and now. What is enjoyable now? What do I want to do now? And we focus a lot less on that far flung future. So we can dismiss the long term consequences of things like eating unhealthily or smoking because, well, it doesn't have a dramatic effect right now. I'm not experiencing negative consequences now. And getting away from those, doing the healthy things, stopping smoking, eating better, those are things that take a lot of effort, and we don't necessarily see the payoff right away. So, one way that we can look at it in terms of consequences of our actions and near versus far consequences. And of course, anytime we talk about trying to promote health, we get into the concept of self regulation. So, wanting to exercise voluntary control, basically willpower, to do the things that you are supposed to do, like exercising, or avoiding the things that you are supposed to avoid doing. So, that's what this term is talking about. Now, again, this self regulation means that you have to focus on that far flung consequence of if I do this now, this dieting and exercising that in the short term is uncomfortable, but it gets me long term health benefits. You kind of have to overcome the instant gratification. You can delay gratification for those future long term effects. But of course, as always, when we talk about self control, we don't always have good self control. And again, near consequences versus far consequences are weighed very differently. There's also a lot of things like if we consider strategy, how do we convince ourselves to do the healthful things? Or how do we convince ourselves to not do the harmful things? We're not necessarily equipped to manipulate and control our own behaviors. We might think that this is a good strategy, but it might not work for us. So we're not the best at making ourselves do things we don't necessarily want to do. So, all of that just to be a brief discussion of the fact that we would like to do more of this, we would like to do less of this, and that's not always the case for a variety of very complex reasons, which makes sense in a class on psychology.